Welcome back to WBRZ News 2 at 4. Dr. Stevens is here today, and we're talking about breast reconstruction and its benefits. So welcome back, Dr. Stevens. How you doing?
I'm fine. Glad to be back again. And really what we're talking about, we have a new study that was published in the Plastic and Reconstructive Surgery Journal out of Boston Children's Hospital, which really was one of the first of its kind. It looked at adolescents with breast asymmetry, gross asymmetry, whether it was breasts that just didn't develop or enlarged breast called macromastia. And it looked at the social well-being of these children, if you will, age 12 to 21, and it showed that they really had a decrease in self-esteem and overall just decrease in social wellness. And so the study pointed out that if we had early intervention in these, as in just evaluation, not necessarily treatment, but possibly treatment down the road as they aged, that it would help them significantly with these issues, whether it be eating disorders or just overall self-esteem. And so it points out that this is not necessarily a cosmetic issue, but this could be a functional issue, and perhaps even insurance companies should look at it that way and maybe provide coverage for some of these services later on if they would need a surgery, for example.
Okay, so you mentioned treatment. What kind of treatment are we talking about?
If obviously, ladies that have macromastia or enlarged breast, this would be a breast reduction. And as a matter of fact, we see a lot of that this time of year with kids have off during their college breaks. And so I see a lot of this in the ages of 18, even up to maybe 15 to 18 years of age. Makes a significant difference for these young ladies when we actually reduce the breast. They feel better about themselves. Eating disorders may improve. A lot of other social issues are improved with that as well. And so I think we need to look at this as a functional problem, not necessarily a cosmetic issue.
15, I mean, that seems a little young.
It can be, and it depends on the child, and it depends on how they've developed and if they have stopped growing at that point. And so consultation with the pediatrician along with the plastic surgeon is recommended, and determining if surgery is really the avenue, or perhaps it's maybe a weight reduction first. And then we can look at maybe doing breast reduction as they age and when the breast becomes fully developed.
Of course, but you have to discuss this with your doctor.
Absolutely,
and your family.
Discuss it with your family, your pediatrician, as well as the plastic surgeon.
All right, thank you so much, Dr. Stevens. We appreciate it. You're watching WBRZ News 2 at 4. We'll be right back.